All right, I think I can start, Leila, right? Yeah. All right, hi everybody. My name is Bahman. I'm a reader in business analytics. Actually, it's a funny title, reader. It's a pretty nice title, but last week I was chatting with someone, and then I said, what do you do? I said, I'm a reader at Cardiff University. And the next question was, when do you finish your PhD? And well, I said I finished it 10 years ago. But anyway, it's a funny title of being a reader. So I'm talking about what Leila and Wendy actually started talking about, data in vaccine supply chains. So this is the outline of my presentation, a very brief introduction to immunization supply chain. So again, Leila and Wendy briefly introduced that. And then focusing more on what is the forecasting problem here, and then show you some data of vaccine consumption in Kenya, and then the forecasting setup we had, and some forecasting evaluations, and what are the next steps for this project that we do with the JSI together. I think we tend to forget about, some important elements of, having a vaccines, and but, these figures are quite shocking if you look at them. And despite all the progress, the scientific advances, there are still some major issues. And the reason here we talk about them in a forecasting conference is because some of these issues are related to how the supply chains are managed. And we are hoping that we know with accurately forecasting the needs, not only needs, but maybe other requirements, we can also contribute a little bit to overcome these important challenges. So again, if you are new to this area like me, this is what is called a vial. This is a dose. And then this is a dose administrated. And then in addition to these three definitions that we need them as I go through the data later. So as you may know, for each vial, we may get multiple doses. And then when we say dose administrated is the one that goes to the arm, right? So in addition to that, we may have waste as well. So there are two types of waste, open waste or closed waste. So closed waste is more related to date of expirations and things like that. So it is the vials that are not opened, but the vial may be open as well, but all the doses are not used. Those are counted as the open waste. So what is what we define here as the doses used or consumption or needs is doses administrated plus waste. This is a simple diagram of a supply chain in Kenya, but I assume more or less is the same in other countries. So, so in the left here, you have a national warehouse. So vaccines are received there in the airport and then transformed to the national warehouse. This is managed by the government through a three-party, and then later on they send this to regional warehouses, and then from the sub-county they have to collect the vaccines, and then in sub-county also there is a store, but at the county level there is no store, but the county level they are responsible for managing the distributions from the regional to the sub-county. And then in the bottom, you have the health facilities, and this is where the people go and have their jobs. So this will, again, as I come back to this later, basically this helps us also to introduce a structure in our supply chain forecasting later. So what do you want to achieve? In general, we are looking for the higher coverage, but also there are some other important utilities that you want to focus on. We want to have lower costs, lower inventory costs, lower waste, lower inventory costs, reduce missed opportunity, which is again related to stock and stock outs. Again, lower societal costs in general, like disabilities and things like that. And then, of course, better coordination. So we're hoping that by generating forecasting in a different way, not necessarily even more accurate, but in a different way, we can help with some of these goals. So, and that's where forecasting comes in. So forecasting accurately the needs is one of the key elements in achieving these goals. Now, what is the forecasting problem? As I showed you in the supply chain, so we are going from a national warehouse to health facilities. So this is the map of Kenya, which is divided into regions and then counties and sub-counties. And again, combining this with the supply chain that I explained, we have now a hierarchy. And so in the bottom of the hierarchy, the data at least we have here is up to sub-county. We don't have the health facility data. So we have 306 sub-counties, then aggregated to county where we have 47, and then 9 regions, and then of course total Kenya. So this is the forecasting problem that we are looking at. So we are interested in forecasting for each sub-county, each county, each region, total, but also the aggregation of those levels as well. For instance, total vaccines, total region, total sub-county, and total county, etc. So again, Leila discussed about the classical approaches that are used in this. So here I mentioned 2, demographic methods and the service-based forecasting methods. So these consider different elements, and for example, in demographic methods, normally these elements are given, and then it's just a multiplication of these elements that gives the final forecast. And then, so Pablo asked about whether the forecast exists as a benchmark. Basically, the forecast, as again Leila mentioned, is just an annual, yearly level. And this is so an annual forecast at the national level. But what we need really is more disaggregate, and the only way to achieve that is to disaggregate by dividing by 12 to get the monthly, and then disaggregate by population to get the forecast in different nodes of the hierarchy, and hopefully that can be used as a benchmark. And this is actually what we do. And this is basically one of the main drawbacks of this forecasting problem. I mean, the current way of doing the forecasting, because it's high level, right? So the forecast is generated in the lower frequency, annual, and then again national levels. So it is not really useful for operational or tactical decisions. And then it's not also capturing the information that we have in all these different levels. And it completely ignores that there is a structure. So forecasts are generated separately. And this has some consequences as well, because it can lead to conflicting decisions. And of course, lack of coordination. Because remember, at the end of the day, all of these levels, they are managing one product, which is a vaccine, but at different levels. So if these are the like sort of limitations, what we can do? Well, there is now about maybe, well, the hierarchical time series method are known for, I think, many decades. Classical approaches include top-down, bottom-up, and middle-out. So in the bottom-up, you forecast the bottom of the hierarchy that I showed you, and then you add them up to get the higher levels. In the top-down, you forecast the total, and then you disaggregate to lower levels, and the middle-out, you pick a level in the middle, and then to get to the bottom, you disaggregate, and then to get the higher levels, you aggregate. And then I think more recently, maybe in the past decades, there have been a lot of work actually in hierarchical forecasting. And I think in ISF, I think there are at least 5 talks around hierarchical forecasting as well. So you can attend those talks. So here we just considered the optimal reconciliation that was proposed by Heinemann et al. I think I put the footnote of the paper here, but so you can find more information about this by going to the book that Rob Heinemann mentioned at the beginning, FPP3. So there is a chapter discussing this. But the whole idea here is we first generate what we call the base forecast. So forecast at different levels and each node separately. And then we use this forecast that we generate to regenerate another forecast that is reconciled. So it can add up forecast. And then by doing this, there is a chance that we get more accurate forecast because we're using information at different levels, but also more importantly, we can get now, a forecast that can help us to be, to coordinate the activities, right? Because the forecasts that we generate at different levels are adding up, so we don't have any problem like that, and it is better. It is easier to use this for coordination. Now, in terms of, so these are the three approaches that I use here as well. So I have a base forecast, I have a bottom up and top down, and optimal reconciliation that we use here. So now, which data that do we use here? We use the data from, as I said, from Kenya. We have the monthly data from January 2013 until December 2021, and for 4 types of vaccines. So again, we have that 306 sub-county, 47 county, and 9 regions. And in total of the hierarchy, we have 1,452 time series to forecast. This is the first 5 rows and the last 5 rows of data, just to give you an idea. So what we have for each month, each region, each county, and each sub-county, and each type of vaccines, we have the doses administered and doses used. So I didn't show you the waste here, because quite frankly, it's shocking, the numbers that we get there. But again, it may go back to the quality of data, because as I show you later, there are some important issues related to data quality. So the waste is quite huge. So this is, I don't know if you can see the plots clearly, but so this is just one example to show you the time series of different vaccines at national level and region levels. So as you can see, some of them, they may have trends. Some of them, they may have also strong seasonality, at least in this level. But because now we have many time series, it's difficult really to show you everything in one single plot here. But what I'm trying to tell you is, in the monthly time series, we get some patterns. And this is for administrated only. Well, to show you a little bit more, so here I extracted the trend and seasonality trends at different levels. So I plotted the trend in x-axis, and then the strength of seasonality in y-axis. So of course, higher, it means better in terms of having the trend and seasonality pattern there. But you can see that, for instance, for bottom series or county, you can, and of course for different regions, for example, one of the regions, they have like higher seasonality than others, which is Mombasa RVS. But you can see also most of this time series, they have quite a strong trend as well. But again, there is, it's spread across. So you have some time series with less strengths in their trend and seasonality. And I think the exponential smoothing family of model would be a reasonable choice to start with, given the time granularity of the time series, which is monthly, and then ETS is a method that proven to be good for monthly time series, given this structure with trend and seasonality there. So this is another story now. Look at this data. This is the doses used. We have some negative values for doses used. Well, which is, we have discussed, it might be possible in some cases, but again, you get, the value is just huge. And then we need to deal with this, but also we got some spikes for the positive side as well. So this is the reason that I didn't use actually the doses used so far. I mean, we had meetings to discuss that. We are in contact with people in Kenya to help us to understand why we have these issues, and then how we can impute, this spikes in both being very high or with negative values, because normally negative values, they don't make sense at all. So I'm using exponential smoothing method. Forecast horizon is 12 months, and I do time series cross-validation with re-estimation using around 36 period as a test, and the rest for the training. And I'm evaluating point estimation based on RMSSE and mean absolute scale error, and root mean squared scale error. And then here some results for different vaccines. For instance, for BCG, we see that optimal reconciliation can improve actually quite well, about, I think, 15% comparing to the base and other approaches in across total region, county, or sub-county. If you look at DPT, then we can still see some improvement with optimal reconciliation. But again, remember what is important here now. With this forecasting, we could coordinate our activities much better. When it comes to the OPV, it seems that bottom-up is doing a better job than optimal reconciliation. And then for measles, again, bottom-up is doing a better job than others. So this is for doses administered. We don't have any forecast for doses administered to compare again, but we have some annual forecasts that I mentioned for the national level for the doses used that we can disaggregate, and I have already done that, but because the doses used are not reliable, the data that we have there, so we need to somehow deal with those inaccurate informations, and then hopefully we can make a comparison there as well. In terms of the next steps, so we have to first, fix this quality data issues. I'm also planning to not only look at the point estimation, but also look at the probabilistic forecasting and report that forecasting there, because I think it would be helpful here as well. And then I compare again the current approach, hopefully. We also realized during the data visualization that there might be some important predictors that we could consider as well. So we got some data for conflicts in Kenya that could be helpful. So again, the data, we collected them from this website. And in addition to that, we also have population, total population, child population. We can have different type of violence in the country. We have also in our discussion with people in Kenya, the rainfall season might be also important, but also we extracted some important holidays in Kenya to include in our model as well. So there is another related talk to this project, which talks about the inventory management part of it, which again, the idea of doing this forecasting is really to be used by the supply chain, in particular by inventory control. And in that talk, we talk about this a little bit further. So if you're interested, you can join there. And thank you to the JSI team, Leila and Wendy here, but also Gurmeet and Amos, they're not here. And also all this work, for all this work, I have used Tidyverse, the packages that Bahman introduced before, like Fable, Fist, and Festival, and Tidyverse to create the whole presentation, but also forecasting and analysis. And also thanks to Harsha for his support to get some of this data that I mentioned we're planning to use later. Yes, some resources again at the end if you want. This presentation is available in my website as well, so if you're interested, you can get the presentation there. But at the end, you will get also collectively the whole presentations in a website to access them if you like. Yeah, that's it. Thank you. Any question? Yes, Mehdi? The base is just the forecast generated separately in each country. Yeah. Nothing, yeah. Just ignoring completely the structure of the data. Yeah. But ideally, I wanted to replace that with the forecast that is generated in JSI, or is it generated by? Yeah. So I wanted to use that, but so again, for that reason of data quality, I cannot do that. At sub-county, because they don't have an inventory warehouse in county, in sub-county, region, and total is very important, because they are going to use them for managing the inventories in there. And again, as I said, the level of waste, again, if the data is accurate, is really high. So some reason could be related to this. It could be other reasons as well. But yeah, so, but also there are stockouts. But the problem is, I don't think those stockouts are reported in the data set as well. So you don't really get them there. So forecasts are required in those three levels. But you're right. Yeah, it might be. I don't know really now, but it might be some cases where some they have, you know, more importance, or maybe if there is a low vaccine coverage in general, maybe that county is more important, something like that. Yes, please.
Could you go back to slide 12? I mean, I would have intuitively expected that if you've got a good forecast for each of your sub-counties, that when you aggregate and add them up at the county level, you would have a good forecast for the county level as well. Why doesn't that always happen? When does that assumption break down?
When the forecast at the bottom level is good. Yeah, that's a good question. I don't know. Maybe do you know? Yeah. I mean, the one thing is, so I'm not sure if that's relevant, but one thing is to use the information on other level, like in the upper level. Sorry? Yeah.
And that might not be exactly aligned with the
But that's exactly one point. We have discussed this before, so I'm not sure if relevant, but that's one point. So at the moment, it seems that there is not a link between, you know, how these things are communicated, and that could be actually one reason to do that. But maybe, sorry, do you want to say something?
So that one, there could be theories of why after the one. One is there is always a problem that the models are often prone to overfitting. One problem with the forecast, but if you think about more than you probably should get. Yeah, and the data also, like, you might have to use the data.
Well, it could be one model, or it could be multiple. It could be just one single model with the same parameter used in all nodes, but it could be different models, and that both are possible actually.
And another thing is the seasonality. Giving them the seasonality.
So just to add to this point, so in general, when you do aggregation, including this one or temporal, the features change. So for instance, the strengths of trend, as I showed in one of the slides, the strengths of trend or the strengths of seasonality in the bottom level might not be the same as the others. So as you go higher, for instance, some of these features may become more obvious, some of these features may disappear. It might be like that, yeah. But in general, if you have a good bottom series, like the presence of trend and seasonality is quite strong there, actually bottom up should work. bottom up should give you a good forecast. In some examples, we have seen that as well. So bottom up is doing better in some cases, and because maybe the structure there is pretty easy to pick comparing to the others. Yes, Shishma? Yes.
So if I may add, I think that the covariance of the forecasting errors is important here. For example, if you have highly correlated forecasting errors, when you add them together, if one time series is over forecast, the others are over forecast simultaneously. You add them together, the exact errors. But if they have negative covariance, the forecasting error can somehow cancel out. So that's why the covariance in this